Okay, let's unpack this. Today we're doing a quick deep dive into something called the Ferritin blood test.
Ah, yes, Ferritin.
We're using info from the Blood Test UK website, actually, and the mission. Really understand what this test does, and importantly, why getting it done locally, say, in Warwick, could be a big plus for your health.
Absolutely. So, Ferritin, the simplest way to think about it, it's like your body's iron vault, a storage tank, if you will.
An iron vault. I like this. So the test just checks how much iron is in the vault.
Exactly. It tells you how much iron you've got stored up, ready for when your body needs it. Pretty straightforward, really.
Okay, so why is checking that vault level so crucial?
Well, the Blood Test UK material points to two main scenarios. First, low ferritin.
Right, low iron.
Yeah, and if it's low, that can mean iron deficiency anemia. Now, people hear anemia and sometimes think, oh, maybe not a big deal. But the key thing here, the real takeaway, is the fatigue. That chronic weakness, feeling wiped out all the time, it can seriously impact your life.
So catching it early is like the main goal there.
Definitely. It's a game changer. Stops it from getting severe.
Okay, that makes sense.
Yeah.
So that's low ferritin. What's the other side of the coin?
Well, sometimes the vault isn't empty, it's overflowing. High ferritin.
Too much iron.
Precisely. And that can signal something called iron overload, often linked to conditions like haemochromatosis.
Haemochromatosis. Okay.
And this is really important because, the symptoms, joint pain, tiredness, they can easily be mistaken for just getting older or maybe arthritis.
Ah, so it's easily misdiagnosed then.
It can be, yeah, which is why testing is vital.
So if it is too high,
Yeah,
what do doctors even do? How do you manage too much iron?
good question. Essentially, they need to reduce that iron load before it starts causing trouble for organs like your liver or heart.
Right, you don't want that.
No. So a common treatment mentioned in the sources is something called therapeutic phlebotomy.
Phlebotomy. That sounds technical, like bloodletting.
It is, essentially, but controlled, obviously. It's the regular planned removal of blood to physically lower the amount of iron in your system. Think of it like personalized maintenance for your iron levels.
Okay, personalized maintenance. That leads nicely into the benefit the sources really highlight, doesn't it? Early detection.
Exactly. Regular testing gives you that early warning, whether your levels are trending low or high.
So you can get timely help, maybe dietary changes, maybe supplements, or maybe something more involved like that phlebotomy before things get serious.
Spot on. And this is where the local aspect, like the services in Warwick mentioned on the Blood Test UK site, gets really interesting.
Right. Let's talk about Warwick. Why does getting tested there or somewhere similar make such a difference? It's not just about driving less distance, is it?
No, it's more the whole system. The sources point out a couple of key things for Warwick specifically. First, local experts. You've got skilled people right there who can interpret the results and give solid advice.
Okay, local expertise. Makes sense.
And second, speed. This is a big one.
Getting results back quickly.
Yeah, the clinics there often use really up-to-date tech, so you're not waiting weeks. The Blood Test UK info suggests you might get results back, within just a few days sometimes.
Wow, days. That definitely cuts down on the worry time.
Absolutely. And the other side of convenience is just making it easy to do the test.
How so?
Well, the site mentions places in Warwick, like Warwick Hospital, Central England Healthcare, the Warwickshire Clinic, GP Health Partners. They often have simple online booking.
Okay, easy booking.
And often walk-in options too. That flexibility is key. It means you're more likely to actually get the test done when you need it, especially if you need regular checks, less putting it off.
Good point. So quickly then, what about preparing for the test? Is there anything special you need to do?
Yeah, a quick snapshot prep. Usually you'll need to fast no food or drink except water for about 8 hours beforehand.
8 hours.
And crucially, stop any iron supplements you might be taking for about 24 hours before the test.
Why is that?
It just ensures the test measures your stored iron, your true vault level, not the iron you just took in a pill or eaten a steak. Gives a much more accurate picture.
Got it. Accurate picture is key.
So pulling it all together, what's the bottom line here? Monitoring your ferritin isn't just another test. It's about getting information for really personalized health management.
Tailored plans.
Exactly. Your doctor can create a plan just for you, diet advice, maybe supplements, maybe those phlebotomy treatments based on your specific iron levels.
So taking control of ferritin is really about tackling that fatigue, that energy drain proactively before it becomes a major issue.
Precisely. And like the Blood Test UK source notes, while maybe an annual check is fine for many people, others might need it more often. People at higher risk, maybe during pregnancy, or if you're vegetarian or have certain genetic factors, they might need more frequent monitoring.
Right, makes sense. It really comes down to knowing your own body's needs. So, thinking about all this, what stands out most to you about managing your body's iron supply?